When should you consider having surgery? It's not a simple matter. One thing I would say is the difference between a major operation and a minor operation is a minor operation is any operation on somebody else. In other words, this is a big thing you're talking about here. Operating your back is a major thing, and you'll be out of action for a long time, many weeks or even months sometimes, and there are major risks. So, and there's no guarantee it'll be successful. Now, the word successful is thrown around quite casually with this thing, but what do you mean by successful? They might say we've got an 80% success rate. Your idea of success and the surgeon's idea of success won't be the same thing. The surgeon's idea of success is you've got the disc out, there was no bleed, no infection, it's all healed up nicely and we're good. Your idea of success is I can do anything I want without any pain and play football or whatever it is. Well, the chances of that are very slim after surgery. I have to tell you, you're not going to get that. You may get, though, a degree of pain reduction which makes you think, well, it was worth doing. About 53% of people are satisfied. Satisfied means I don't regret having the operation. But it doesn't mean you feel marvellous. It means that the pain has reduced somewhat and you feel that if you hadn't have done the operation, maybe it wouldn't have happened, so you're grateful. So this is the sort of area we're in. So I'd always try everything else first. Try physical therapy of one kind or another. Chiropractic for me is the best. Acupuncture works quite well, sometimes with this as well. And exercise. Always need to exercise. So do all of those things first. And if it's not changing and not getting better, then consider the next step. And that won't be surgery. That will be maybe an injection if you want to go down that route. I don't like them, but some people find relief with them. And surgery should be the last resort, really. How about if you're so bad with your back, you're getting bowel and bladder, lack of control of your bowels and bladder? Well, that is a time to be concerned. And sometimes people think, well, in that case, I'll have the surgery. And in most cases, if you have the surgery, that will go away, but you'll still be maybe painful in the back afterwards, but at least less symptoms, fewer symptoms down the legs. So it's not a cure-all by any means, and it's not guaranteed by any means at all. So be very careful and consider it. And always make sure you have a proper diagnosis. That doesn't mean to say have an MRI scan. That means you have a proper consultation where the person knows everything about you, your medical history. Then you have an examination and they check everything, and then the scan or the x-ray or whatever, and put it all together. That's a proper diagnosis. And always get a second opinion before you consider going down the route of surgery, because it's a huge step to take. I'm not saying don't have it. Some people have surgery and they're happy afterwards. Yes, it does happen, and everyone's different. I would say it's the last thing to try, really. It's the most risky and the last thing to try. But if you have to have surgery, I wish you luck. And some people do get better with it. So see what you think. Thanks for listening.